So how are you going to manage the thyroiditis related hypothyroidism? Definitely NSAIDs or steroids may be required to reduce the inflammation if there are signs of inflammation. Then if there are signs of hypothyroidism, definitely many times we need to give the replacement with thyroid hormone and pain management. So actually the topic of the thyroiditis is definitely there in hyperthyroidism and sometimes in hypothyroidism. So we need to be aware of this topic. So I have included these slides also. Regarding the replacement therapy for the thyroiditis, so depending on the body's weight, blood monitoring, and once in a daily empty stomach is given for as per the whenever we treat any patient of hypothyroid, similarly we treat the patient for thyroiditis. So there is not much difference. So let's move to the primary hypothyroidism. How we are going to examine the patient, assess the severity, and how we are going to treat. So clinical history definitely is very important, but we do get subclinical case or we do miss the clinical presentation of the hypothyroidism. So many a times we send thyroid sample of many patients of our ICU admission where we get dyspnea under evaluation and we found out that it was related to hypothyroidism. So how we diagnose? Definitely TSH and pre-T4 is going to be very important in testing. TSH is produced by the pituitary gland and stimulate the thyroid to produce the hormones. So whenever there is disease related to thyroid gland,